and Brad, the two most famous physical therapists on the internet.
Good posture.
Howdy folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Okay, Brad,
You're giving me a headache, Bob.
All right, well I'm going to try to help you get rid of it too, Brad. This is basically about what we call maybe a neck headache.
Okay.
It's a headache that originates from your neck. So if you're feeling pain in your neck, and a lot of times what it does, this type of headache tends to come up around the skull here, and sometimes even into the eye.
Sure.
A lot of times it's one-sided, but it can be both sides.
Right.
It can come around both sides.
So when you're saying neck, we're talking about that base
Yeah, the base of the
the
head.
skull.
Of the skull, yeah.
upper neck, right in that area where that bone kind of turns into muscle.
Yeah. Not only can this help relieve it, to me, better than that actually, more often is it stops it from happening. If you start to feel some discomfort and maybe a slight headache, that's the time to hit it. Once it's full throttle, I don't know that, then you're going to probably have to either use ice or something else like that to help take it away.
But you can still see it.
You can certainly try it, yeah. So very simple massage.
Right.
Brad, why don't you flip around and we can show on you. The first part is you're going to do basically what we call a splaying massage. So you're going to start with your thumbs together and then pull them apart. You're going to run right along the skull.
I actually like to do it with my fingers.
Yeah.
My thumbs aren't that long, Bob, but yeah, there. And see, now I'm going to go like this and put a stretch on the muscles, but you can also do it this way, and you're going to do it which way helps. Okay, everyone's a little bit different. Do you have anything to add in that, Bob? I'm going to work it down here.
Then you're going to go into a circular motion too. That's the one that often helps, is making little circles all the way along the skull line there. And you may find a spot that's really tender, and you may want to work around it first before working right on it.
Right.
And then eventually work right on it also.
And you'll know, because you'll feel the spots that are effective. I mean, I can feel it right in here for me. You're not going to get on the bony part. It's just below that bony part, the occiput, or some people call it the skull pan.
Sure, and whatever you're, but the thing about this is that you can do this anywhere, anytime.
Sure.
You can do it while you're watching us on the computer right now.
Right.
And then the other good thing you want to try is some chin tucks. Brad, do you want to show that?
Chin tuck just like this.
So yeah, it looks like, again, Brad always says if someone is going to take a pie and throw it in your face, and you're just bringing the neck back. You're not dipping down like this. You're not dipping. You're not looking up like this. You're going straight back.
Right.
And you're doing chin tucks. And sometimes people even put a little extra pressure on that. And it's stretching that same muscles back there
Right.
while you're doing this.
And you also can, you're not going to do this, you're going to have to take some time off getting the chair, but if this, a cold pack, and put that on there in the recliner.
Right on the base. Yeah.
And, recline back on a nice recliner. And
even though you're feeling the pain up in here, it may be coming from here, especially if you feel some pain in the neck along with it. So.
All right,
Good luck with that. Get rid of that pain.
Right. So this is another thing where this is getting closer, but we're getting closer to fixing that broken heart.
Oh, that's right. We can fix just about anything, but we can't fix
the broken heart. But it's coming. We're getting there.
That's right.